Hello, I'm Maria Ressa. Welcome to Talk Thursday. In 2011, the World Health Organization said tuberculosis remains a significant health concern. The rise of multi-drug resistant tuberculosis, or MDR-TB, in the past 2 decades has just made it harder to treat the disease. An estimated 440,000 new cases of MDR-TB emerge each year, killing 150,000 people. In the Philippines, 75 Filipinos die every day from tuberculosis, but the country's national tuberculosis program has helped reach a case detection rate of 75% and a treatment success rate, one of the best in the world, of 87%. Here to talk about the rise of multi-drug resistant tuberculosis and the challenges of treating it are Dr. Mamel Quelapio, WHO consultant on MDR-TB, and Marc Destito. He's the communications director based in Geneva of Otsuka Pharmaceuticals. Good day, both of you. Thank you for joining us.
Thank you very much
for having us.
Marc, you've seen MDR-TB globally. Can you just give a snapshot? How big of a problem is it and what's being done?
Well, you know, many people don't realize that actually 1/3 of the world's population is infected with TB bacteria. That's quite a shocking statistic, and nearly 1.4 million people die every year from TB.
So some people think that TB is kind of like a dead disease. I mean,
it's forgotten. It's very much forgotten. Many people, especially in parts of the developed world, think that it's a disease of the past, something that we've conquered already like polio, and the facts tell a very different story.
And how has this, how much of that 1/3 of the population have MDR-TB, this drug resistant?
Well, I'll let Mamel answer some of the technical questions. I mean, as you mentioned in the opening, about 440,000 new cases every year, and 1.4 million deaths from regular TB. Now, what's happening, though, is we're seeing a very frightening increase in the number of drug-resistant cases. We're seeing multi-drug resistant TB and also something called extensively drug-resistant TB, where a patient may be resistant to almost all of the medications that are currently available. And that's actually one of the biggest challenges that we're facing right now. There's so few new tools that we have to treat MDR-TB. There haven't been really many new TB drugs in the last 40 years. Many of the drugs that exist have a lot of adverse events, so it's very difficult for patients to stay on their treatment. And sometimes for MDR-TB, treatment can last up to 2 years or more.
Mamel, could you tell us?
Yeah, in the Philippines, well, TB has always been there, Mark, and up to now, it continues to be a public health concern. So if you're asking about the multi-drug resistant rate, it's 4% among new cases. These are the patients who have never been treated before for TB.
Let me ask you first, before we go to MDR-TB, is what about the transmission rate of TB? How many Filipinos get TB? I mean, how big a problem is it?
Well, the exact transmission rate is not known in the Philippines, but TB does not infect very easily.
Yes.
You have to spend hours with a person who has TB.
And your immune system has to be low, right? Yeah.
And the person who is infecting another person has to be smear positive. There has to be bacilli found in, when you get sputum from his phlegm, you have to see bacilli in his phlegm.
Okay.
It has to be positive.
And then how much, Marc talked about 1/3 of the world's population has TB. It's latent TB, right? Meaning, what exactly does that mean?
It means that at one point in your life, you were exposed, but since you were immune, your immune system was good.
Yes.
Your defenses were good, so you did not actually get the disease. You're just infected. It's just in your body, but
so
it's not.
Does that mean you're a carrier of it?
Well, in a way, yes, but you're not going to transmit that to another person
until you get it.
Until you get the disease.
Right.
And you have the infection, but you don't have the disease.
So if you have the infection, it's when your immune system becomes too low to fight it that it can then attack you. Is that right?
No. If you have the infection, that means that you just have the bacilli in your body, but it's not manifesting as disease because your immune system is good.
Okay. And does that mean that you can never have TB, for example?
Well, when your immune system gets low, then that latent bacilli can activate, and you can then manifest with the disease, with all the symptoms like cough, weight loss, night sweats.
I know that in some of the colleges in the United States, they have special tests for Filipinos or Indonesians coming in because we've had high incidence of TB. Is that correct?
Yeah, they have the Manto test.
Yes.
It's an injection where you have to read after 72 hours and check the size. And if it's more than a particular size, and they say you're infected with TB. But for Filipinos, to have a positive test is very common. I'm positive for that test. That means I have latent TB, but I'm not manifesting with the disease. So around 60% of Filipinos have positive
60%.
PPD. That's the other name of that test.
Oh, okay, that's so interesting. So let's move to the drug-resistant strain of TB. So you said out of the people who've had TB before, 4%. No, the first-timers.
Yeah, the first-timers, those who have never had TB before, it's 4%.
Okay.
For those who have had TB before and have been treated, meaning exposed to the drugs, it's 21%.
It's like antibiotics, you know, if
yeah,
you don't...
the drugs are like antibiotics.
Okay.
And the treatment for ordinary TB is at least 6 months. So if you don't finish that, the body has been exposed to those drugs. The next time that you need to take those drugs, your body will not respond to it positively anymore because it has developed resistance to those drugs.
From the stats, it seems like the Philippines has done well in terms of TB treatment. Is that correct?
Yes, the Philippines is doing very well in TB control. As you said a while ago, it has reached the global targets in terms of case detection of 75% and cure rate of 87%. So that's pretty good.
And in terms of treating MDR-TB,
in terms of treating MDR-TB, actually the Philippines is one of the pioneers in treating MDR-TB. It was in the year 2000 when we started to encounter failures in our ordinary TB cases. And we found out that we were dealing actually with what we call the multi-drug resistant strain.
Right.
So in the year 2000, there weren't many countries treating multi-drug resistant TB programmatically. They were treating multi-drug resistant TB in their own clinics, which is not the way to do it because treating TB is not just giving drugs. It's a whole framework of giving patient support, addressing adverse drug reactions, and checking whether the sputum is already negative. So it's a whole framework. So in the year 2000, we started treating MDR-TB programmatically with the help of WHO and in collaboration with the Department of Health. So it was in an NGO where the programmatic management of MDR-TB started in partnership with the Department of Health.
This is not the first time globally, right? But when in the Philippines, was that the first time globally that this happened?
What do you mean?
The treatment of it, because you said that we were leading. No.
Well, maybe a few years before that, Peru was already treating MDR-TB, and then shortly after, around the year 2000, exactly when we started MDR-TB treatment in the Philippines, they launched the DOTS Plus.
Yes.
Well, DOTS, if most of us know DOTS as the WHO recommended treatment for TB.
Yes.
And they added Plus, that's the recommended treatment for MDR-TB.
Okay. Marc, why are you in the Philippines? We're here to look. There's a conference that's happening today on it. But why the Philippines? Where does the Philippines fit in terms of a global response to TB?
Sure. Well, I mean, the Philippines obviously is a very strategic area. There's a very high burden of TB here. Otsuka's been in the Philippines actually for quite some time, and we just recently opened the Otsuka Manila Research Center specifically to address some of these issues. And the work of my office in Geneva actually is to develop public health programs, case management activities, and also advocacy, because it's so important that we communicate and really educate on the disease. So we've been here this week meeting with a variety of partners and stakeholders, trying to see how we can really put this on the map, put it on the radar, especially for people globally so that they understand the disease. And also we've been working with a lot of institutions, NGOs, some of our partners such as the Philippine Coalition Against Tuberculosis, also the National TB Control Program, and many, many others. And we've also been talking to a lot of patient advocates. I've been so inspired this week to meet some really incredible patients, one by the name of Mildred Fernando, who had that extensively drug-resistant strain, not once but twice. And she actually suffered for more than 10 years in treatment. But now today she's happily living TB-free. She's cured, she recently got married, and she's become an advocate. She wants to tell her story, to give back in a way that she can inspire other patients.
If you look at a global landscape, where does the Philippines fit, both in terms of detection and treatment of the
Well, Philippines is doing quite well. As we said, the treatment success rate is quite high. It's higher than many other places. Just to give you a comparison, in Europe, for example, the treatment success rate for MDR-TB is only about 31%, which is quite low. In addition to that, there are a number of different programs around the world, but I think the Philippines can serve as an inspiring example for many other countries. When it comes to MDR-TB, again, the highest burden countries are India, China, Russia, and South Africa. But as we also said, the 4% of cases here that are MDR-TB, there are some pockets in Eastern Europe, for example, where the percentage of MDR-TB among total TB can be nearly as high as 50%.
Wow.
Yeah.
Okay, I guess here today, what is the Philippines doing right? What does it need to do better?
Yeah, the Philippines is, as we said, is doing very well in TB, and having been a pioneer in the treatment of multi-drug resistant TB is actually more advanced than other countries in terms of providing the proper treatment for MDR-TB. It has been advocating to the Philippine government to increase funding for multi-drug resistant TB, because the funding for one case of multi-drug resistant TB can reach up to $4,000 per patient, because the treatment is very long. So the advocacy campaign for the top-level management in the Philippines is being strengthened so that more funding will come in for MDR-TB. And it also has been expanding the MDR-TB program all over the Philippines. Okay. So it had its pilot in the year 2000. It was just in a small NGO, and then it slowly expanded to the whole Metro Manila region. And right now, I think it's in almost all the 17 regions of the Philippines through the efforts of the Department of Health and together with all the partners. So there are specialized centers now treating multi-drug resistant TB in almost all the regions of the Philippines.
You guys have actually talked about things I hadn't really known, but for ordinary people, why should they care about MDR-TB?
Well, they can care because our message is really that TB can affect anyone, anywhere. So this is not a disease that's gone. This is not a disease just of poor populations or developing nations. This is something that can really affect anyone. And the thing about TB is that it's a long-term issue. I think oftentimes when we talk about sustained commitment to TB, we have governments or administrations, they tend to think short-term, right? So they're investing money now, but maybe they're not seeing an immediate result. It's not like other therapeutic diseases where you invest a lot of money in the short term and you see a result in a year or two. TB, you really have to have a long-term comprehensive strategy. And so our message is that the funding needs to stay where it is. We want people to maintain their commitment, whether it's private funders, public institutions. That's really why people should care, because this is, many people have often described MDR-TB as a time bomb. That if we don't do something today, we're just pushing the problem for future generations. 1/3 of the population is infected, but they may not know it for many years. They may not activate for many years. By then, we don't know, they don't know where they acquired TB. We don't know how many other people they've infected. So you can see that the problem can really spiral out of control. That's why we need a commitment today.
What is your worst case scenario?
Well, I think the worst case scenario would be, again, people are traveling across borders now. If we reduce funding, if we're not treating TB today, and also if we're not really working to prevent drug resistance, especially for new TB drugs that may be coming in the future, we're going to lose those drugs, and they're not going to become effective. And then you're going to have increasing rates of TB and no tools with which to combat it. And that could spread very, very quickly. That's probably my worst case scenario. I don't know what you think.
Yeah, there is fear that if we don't control or if we don't treat MDR-TB the right way, we can reach a scenario where there is total drug resistance. Because MDR-TB is just resistance to the two most potent drugs for TB, isoniazid and rifampicin. And there are second-line drugs that we use to treat multi-drug resistant TB. But if we don't treat the MDRs in the proper way, they can also become resistant to the second-line drugs, and they can become resistant to all the drugs. So that's what will become the predominant strain, and that will spread. Total drug resistance is the worst case scenario.
You don't see that happening anytime soon. Okay, so in terms of the difference between TB and multi-drug resistant TB, TB, the symptoms are, I guess, the normal symptoms: fever, fatigue, cough.
Yeah, most important symptom is cough.
Cough.
At least 2 weeks.
Yes.
Yeah, with or without all those other symptoms that you mentioned: weight loss, night sweats, blood in your phlegm.
In your phlegm.
Yeah.
And multi-drug resistant TB, is it easier to? It's the same.
Yeah, but there are clues for you to detect or to suspect MDR-TB, and the biggest clue is previous treatment. So previous treatment that never got finished, or exposure in the household to somebody who has multi-drug resistant TB. That's also another clue. So those are more or less the...
Are we educated enough in the Philippines in terms of dealing with TB? Because again, like what I was told is that in a shanty town, for example, in an area where you're with a lot of people, it can spread easily.
The efforts for advocacy have actually been strengthened in the past few years.
Yes.
But I think we still need more efforts to continue, to spread the word how TB is transmitted.
Yes.
How it can be detected, where services are, so that people automatically go to these facilities where TB is being diagnosed and treated. So more efforts are needed.
Fantastic. Your last thoughts, Marc?
No, just that, in addition to the advocacy that I mentioned before and the public health programs we're working on, Otsuka has also been investing in TB research for more than 30 years. And we're very active in the Philippines. We're very proud to be conducting research here. And we just actually recently launched our pediatric program for TB right here. Our very first patient actually in the very first clinical trial ever conducted in children for MDR-TB. So that's an exciting milestone, and pediatrics is often another area that's very overlooked. We call it a neglected area of an already neglected disease, because people don't realize that TB and MDR-TB can also infect children, who in some cases are the most vulnerable.
When you do clinical trials in a country like the Philippines, is it different from doing clinical trials in a developed country like the United States? Do you have to go through different tests, or?
Well, I think the challenge isn't so much where the trials are conducted. The challenge is that for MDR-TB trials, it takes a tremendous amount of work. They're very complicated, especially when you're talking about with children.
Okay.
So we have an excellent team in place here that's working with a variety of partners, people like De La Salle Institute, also the Tropical Disease Foundation, Quezon Institute, many others. So it really takes a whole team. It takes a lot of collaboration from many different areas, but it's hard work, and sometimes it's slow going. But as I said, Otsuka's been in this now for more than 30 years, and we're very committed to see it through.
Fantastic.
Well, last words.
Yes, please.
TB is curable, and the Philippines has many centers that are able to detect and treat TB, and not just TB, but also multi-drug resistant TB. So if you have the symptoms like cough, primarily of more than 2 weeks, with or without all the other symptoms, consult your nearest health center, because they can provide you the diagnosis, the right diagnosis, and the right treatment.
Fantastic. Thank you so much for joining us. We've been speaking with Dr. Mamel Quelapio. She's a WHO consultant on MDR-TB. And Marc Destito is the communications director based in Geneva of Otsuka Pharmaceuticals on the challenges of dealing with multi-drug resistant tuberculosis. I'm Maria Ressa. Thanks for joining us.